Hello, and thank you for joining us today for our virtual Healthy Minds, Healthy Bodies seminar. Today's topic is about how to lower blood pressure by implementing the DASH diet into your daily routine. Our presenters today are McKenna Parker, registered dietitian and certified diabetes care and education specialist, and Jen Chilinski, registered dietitian and a diabetes care and education specialist. Both McKenna and Jen work at Good Samaritan Regional Medical Center in diabetes education. Welcome, McKenna and Jen. I will now hand it over to the two of you.
Good afternoon, everybody. I'm McKenna. That was a wonderful introduction. And before we kind of jump into the bulk of our presentation, I think it's important that we set out a few definitions. And so the first thing is, what even is the DASH diet and what does it stand for? And DASH is actually an acronym that stands for Dietary Approaches to Stop Hypertension. So hypertension is just the medical term for high blood pressure. And nearly half of the adults in the US have high blood pressure. In fact, in 2019, there were more than 500,000 deaths that listed high blood pressure as the primary or contributing cause. So it's kind of a big deal. A lot of people struggle with their blood pressure. Now, high blood pressure causes a whole host of issues, primarily because it causes your heart to work harder to have to promote blood flow, which causes damage to your arteries and organs. And this increases your risk for things like heart disease, kidney disease, and stroke. Now, diet has actually been found to play a very large role in supporting and helping to prevent high blood pressure. Now, Jen and I chose this graphic here because we really felt that it illustrated what's going on when someone has hypertension or high blood pressure. So in a person with high blood pressure, the walls of the arteries are thickened and they're usually more rigid as well. And this can be caused by a host of things, but many of us think typically of plaque or fatty deposits. Hypertension can also be caused by hardening of the artery walls and some other causes as well. And when we have this increased wall thickness, it reduces the interior diameter or the space that allows the blood to pass through that blood vessel. And this also increases the resistance that the heart experiences when it's trying to pump blood through all your different blood vessels. So this means that your heart has to pump harder to move blood through your vessel. So imagine trying to blow bubbles into a drink and you're using a regular soda straw. It blows pretty easily because the diameter of that straw is pretty wide. But if we have a narrower diameter, like with a coffee straw, let's say, it's much thinner and it doesn't have as much space for you to blow air through. So you have to blow a lot harder to produce the same amount of bubbles. Kind of a simple analogy there, but that's what's happening with high blood pressure. These are the American Association guidelines for hypertension, and it lists both systolic and diastolic. And these are the two different numbers that we're looking at with blood pressure. Now, systolic, the upper number, is representative of when your heart is actively pumping blood. So it's the force on the blood vessels when your heart is pumping blood out. The lower number, which is usually also lower, is the diastolic blood pressure, and that is the force on the artery walls when your heart is relaxing. So the American Heart Association considers normal blood pressure to be less than 120 and less than 80 for systolic and then diastolic. And I'm not going to go through each of these in detail, but I will say that, you know, for each individual person out there, your blood pressure goals are going to be different. And this is based on your age and your risk factors and a host of other things. So, you know, today we're not going to be providing blood pressure recommendations, but I definitely encourage people to speak with their doctor for their individual goals. So with blood pressure management, the first nutrient that comes to mind for most of us, especially if we've been dealing with this, is sodium. However, that's just one of the minerals that plays a role in regulating blood pressure. And others include potassium, magnesium, and calcium. And we're going to talk about all of these today. And it's important to note that appropriate amounts and the balance of all of these nutrients is very important. And this is where the DASH diet comes in. So this is looking at current dietary intakes in the United States. Many of us have maybe heard the term the standard American diet, and I think we all know it's high in calories, it's high in saturated fat, it's definitely high in sodium, trans fats, and added sugars as well. We typically have too little vitamin D, not enough calcium, potassium, or magnesium, those nutrients we were just talking about, and most of us don't eat enough fiber. Now, according to the recent dietary guidelines for Americans, and these are guidelines that come out from the, I believe it's the FDA or the USDA. I'll have to look at that. I think it's the USDA. They come out every 5 years, and the most recent guidelines were put out in 2020. And they showed that more than 97% of men and 90% of women do not meet the recommended daily intake of fiber. That is really high, and something that Jen and I talk about a lot in our office, not just for diabetes management, but for general nutrition as well. And we'll talk about fiber today. The average sodium intake for men is about 4,200 milligrams per day and 3,100 milligrams per day for women. So it's very high. We also are greatly over-consuming saturated fat and added sugars as well. And these both contribute, 210 to 330 extra calories per day that we don't necessarily need. Most men, or actually I should say a plurality of men, and most women do not have adequate calcium intake. We eat too many grains, and most of those are coming from processed or refined grains. We'll talk about that a little bit too. And our general intake for fruits and vegetables, as well as legumes and beans, all fall under what is recommended. So the good thing is the DASH diet talks about all of these things. So the DASH diet, again, stands for Dietary Approaches to Stop Hypertension. And it's not just a diet, it's actually a whole lifestyle change and a dietary pattern, and it's designed for different disease preventions and improving health in general. And it originated in the 1990s. In 1992, the National Institute of Health actually funded some research projects to see if there were any diet interventions that were useful in treating hypertension or high blood pressure.
In 1992, the National Institutes of Health actually started funding some research projects to see if there were any specific diet recommendations that were useful in treating high blood pressure. And the participants in those studies were told just to follow the dietary interventions and not include any of the other lifestyle modifications in order to avoid any confounding factors. The results of that study led to the creation of the DASH diet. And it emphasizes whole foods, lean proteins. It emphasizes high fiber. So remember, we talked about how most Americans aren't eating enough fiber. This diet emphasizes a higher fiber intake. It emphasizes higher intake of potassium, magnesium, and calcium, particularly from foods. It emphasizes fruits and vegetables, beans, legumes, nuts, whole grains, and low-fat dairy. It especially limits sodium to about 2,300 milligrams per day, although there are some that will limit to 1,500 milligrams per day in order to be more aggressive. And it also limits intake of saturated fats, trans fats, and added sugars. And the interesting thing here that they found is that it appears that the combination of all of these foods has the greatest impact rather than any single component of the diet. So it's not just about limiting sodium intake, it's about all of these other things combined to give us the greatest benefit. This is just a graphic from the National Institutes of Health. And it simply puts how the DASH eating plan works. Now we're going to go through this in detail and give some examples at the very end. So if you're watching this recorded, you're welcome to pause here and take a look at the graphic, but we are going to go into detail on these things. So the question here is, does it really work? And the National Institute of Health did find that the diet intervention alone could decrease systolic, remember that's the top blood pressure, by about 6 to 11 millimeters of mercury. And this blood pressure lowering effect was seen in both hypertensive, so people with high blood pressure, as well as normotensive, or people with normal blood pressure. Based on these results, the DASH diet, along with the lifestyle modifications that we're going to talk about, can also serve as a preventive measure for high blood pressure. So this diet is great whether you have high blood pressure or whether you don't. And there was another study from the National Health and Nutrition Examination Survey, or NHANES, and it also found that following the DASH diet showed improvements in fasting blood sugars, insulin resistance, inflammatory markers, as well as HDL cholesterol levels. That's the good cholesterol, the one that we want higher. And other studies on the DASH diet have shown a decrease in triglycerides and LDL cholesterol. That's the cholesterol we want to be lower. L for low, H for high. It has been associated as well with prevention and management of heart failure, diabetes, colorectal cancer, kidney disease, and it lowers your risk of heart disease and stroke. So this diet is not just for high blood pressure. This hits a lot of birds with one stone. And again, this is another graphic that you're welcome to pause if you're watching the recorded version. We're going to go in a bit more detail here, and I believe we also included this as one of the references. So what are whole foods? If you recall, the DASH diet does have a focus on whole foods, and these are foods, generally speaking, that are either unprocessed or they're minimally processed or refined, and they don't have additives or artificial substances or ingredients. So these include examples of whole grains, legumes and beans, fresh fruits and vegetables, proteins, nuts and seeds, and minimally processed dairy like plain yogurt, cottage cheese, milk, those things. Now, it's important to note that most of our foods today are processed in some way. So processing itself is literally just handling the food and redistributing it, sometimes in its original state, sometimes it's put in a package, but nothing's really changed. So just because something is processed does not mean it is bad. You know, we're also going to be looking at a lot of these other things. We just want to focus on the foods that are minimally processed. Now we're going to talk a little bit about what whole grains are. And I get this question a lot in my office. And so I think it's important for us to understand what we're talking about when we say whole grain. Whole grains are grains that have all three parts still. And there are three parts to each kernel of grain. There's the bran, the endosperm, and the germ. Now the bran is that outer coating on the kernel. It's multi-layered skin, basically. And this is where most of the fiber lives. It's got some B vitamins and some antioxidants as well, but this is where the bulk of the fiber is. The endosperm on the inside is like that white starchy part. Think of when you see a grain of white rice. That's the endosperm. And that is the germ's food supply. And the germ is the embryo that might sprout into a new plant. And this part contains lots of B vitamins, as well as some healthy fats, a little bit of protein, and some minerals. So as you can see, if we don't have all three parts of that grain, we're missing a lot of really important nutrients. And it's important to note that whole grains are foods that contain all three parts of the grain. So now we know what whole grain is. Well, what is a refined or enriched grain? And a refined grain refers to grains that are not whole because they're missing one of those three parts. Now, grain refining started in the late 1800s because milling technology improved, so it allowed for refining of grains to increase production and get more food out to more people. Well, they found that this led to many widespread nutritional deficiencies. So they started enriching grains. And enriching means that they're taking a refined grain, so a grain that's had most of the other parts removed, and it adds nutrients back. But they don't add back all of the nutrients that they took out, and they're put back in different amounts than they were before. So whole grains are really the best way that we can get the most nutrition from these grains. Now, how do you know if a food is whole grain or if it's not? And this is where label reading comes in. You'll want to look at the ingredient section on the nutrition fact panel. And if you see listed as the first ingredient whole grain wheat or oats, barley, rye, there's lots of different grains it could be. If you see whole wheat, brown rice, oats of any sort, all of these describe foods that are whole grain. Now, if you see refined grains, it'll list it as enriched flour, wheat flour, bran, wheat germ. These are all refined. They are not whole grain, and they will never refer to a whole grain product. So when in doubt, always look for ingredients that say whole grain. Then you'll know for sure that it is. Now, these other terms here that are listed, They're accurate descriptions of the ingredients, but they might be missing part of the whole grain. So when in doubt, don't trust that this means that it's whole grain. Multigrain is probably the most common that I see. Multigrain is great because you're getting lots of different grains in there, but it does not necessarily mean that it is a whole grain. It could still be primarily made with enriched flour, which means that we're not getting all of those important nutrients. Okay. So sodium. This is typically found in the form of sodium chloride, or what we think of as table salt. And sodium is important for many reasons. We know that it flavors food and we use it as a preservative, but our bodies actually also use sodium. They use it to send nerve signals, to contract and relax muscles, and also to maintain balance of water and other minerals. So our body needs around 500 milligrams of sodium a day for these functions. So not a lot, but we do need some. But too much sodium can lead to high blood pressure. It can lead to heart disease, heart failure, stroke, and it can cause calcium losses, which that calcium might actually be pulled from the bone. Now, in most people, the kidneys have trouble keeping up with excess sodium in the blood. And as more sodium accumulates in your blood, the body holds on to water in order to try to reduce the amount of sodium or dilute it in the system. And this increases both the amount of fluid that's surrounding cells and it increases blood volume in the bloodstream. And when there's more volume to pump around, that means that the heart has more work to do. It's got to work harder and it puts more pressure on those blood vessels. Extra pressure means higher blood pressure. And over time, the extra work and pressure can cause your blood vessels to stiffen. And that leads to high blood pressure and increases risk for heart attack and stroke. And it can also lead to heart failure. Over time, that heart can only work so hard for so long. Now, the DASH diet eating plan recommends limiting sodium to 2,300, there we go, milligrams per day. And some might choose a lower sodium goal of 1,500 milligrams per day in order to be more strict, or if blood pressure is a bit higher. I have personally found that 1,500 milligrams is pretty tough to stick to. It's possible, but it's tough. Now, just really briefly here, this is looking at how much sodium is in table salt. You'll notice that 1 teaspoon of table salt is 2,400 milligrams of sodium per day. That's your entire day's worth of sodium on the DASH diet in just 1 teaspoon of salt. So you can see that it adds up very quickly. Now, another question that I get and that I see just kind of out there in the general public, are natural salts better than table salt? And the simple answer is no, they're not better than table salt. All of these salts are made with sodium chloride, and salt really is harvested from salt mines or by evaporating ocean water. And all types of salt are made with sodium chloride, and that nutrient content might vary some based on the type of salt that you're using. So these less processed ones, Himalayan pink salt, kosher salts, all these other different types, they may contain small amounts of nutrients, but the amount is not enough to offer any substantial health benefit. And these different salts really are mainly chosen for flavor or for appearance. Now, high sodium foods. Some of these may surprise you, but sodium is definitely hiding in a lot of different places. Any of these smoked, cured, salted, obviously, or canned meats, that's including fish or poultry, bacon, different cold cuts, ham, frankfurter, sausage, sardines, caviar, anchovies, all of these things tend to be high sodium foods because remember, sodium is used as a preservative. Same with frozen breaded meats or different frozen dinners, like frozen entrees. Any canned entrees, chilies, raviolis, Spam, different soups, salted nuts, beans or vegetables that are canned with salt. Cottage cheese is one that a lot of people don't think of, but it's typically made with sodium. Quick bread mixes like biscuits, pancakes, those things. Salted crackers, any prepackaged mixes like stuffings, potatoes, rice, pickles, olives, and sauerkraut. Those are made with salt, right? I already said soups, or bouillon, like if you're using bouillon cubes when you're cooking. Cup of noodles or ramens. soy sauces, marinades, and salted butter are all places that we might find sodium, and these tend to be higher in sodium than some other foods. And this is not an all-inclusive list by any means, but these are some of the most common places that we see people getting high amounts of sodium from. And we talked a little bit about label reading for whole grains, and label reading is actually very useful, and I think we all should learn how to do it, but it can also be really confusing. There's a lot of things that are put on these labels, and it's tough to know what they mean, and is this a good thing? Is it a bad thing? So when in doubt, go to the nutrition facts panel and look at the sodium content. We know that 2,300 milligrams is where we're trying to cut it off for our day. So remember that goal and keep in mind that we need to look at that serving size on that label too. You'll see some other claims on labels. Sodium for your salt-free. This means that there's less than 5 milligrams of sodium per serving. Very low sodium is 35 milligrams or less. Low sodium, 140 or less. I've seen reduced sodium and light in sodium. So these mean slightly different things. But these might be products that you might be more inclined to pick up and look at while you're at the store and compare the labels between products. So tips for reducing sodium. First and foremost, reading the nutrition facts panel. And a little pro tip here, choose foods with less than 20% daily value of sodium. Now, percent daily value can be kind of confusing, all of those percents on there. Really, it's based on a 2,000 calorie diet, which not all of us need, but we can still use it as a reference tool. So if something is 20% daily value or higher, that means that it's high in that nutrient. So we definitely want to try to avoid those foods that have 20% daily value or higher of sodium. Try to make food at home when you can. So we want to limit packaged sauces, mixes, and instant products where possible. Try adding flavor without adding sodium. So there are many no salt seasoning blends. Mrs. Dash is a popular one. I've seen some people like new salt. Myself personally, I love Mrs. Dash. There are so many different flavor combinations, but also playing around with other spices. There are so many spices at our disposal anymore. I mean, there's a huge spice section at the grocery store. So play around with those. And there's some resources out on the internet that actually give you some ideas of, if I'm cooking this, what seasonings would go good with this. Ditch the salt shaker. So one of the most important things that we can do is not have the salt shaker on the table. Avoid salting your food when possible. There's probably already sodium in the food, and there are other ways that we can flavor it. Pepper would be better. We want to try to buy fresh whenever possible because we know that the likelihood of there being additional sodium is very low. Frozen or canned foods may have sodium as a preservative. This is not to say that we cannot use frozen or canned foods. We just need to pay attention to the label and what they are preserved with. Number 6, give sodium the rinse. So rinse those sodium containing canned foods. So if you have, let's say, green beans or black beans at home already, and you know that they're canned with sodium, put them in a strainer and rinse them in the sink. You're going to get rid of a lot of the sodium off of those. Unsalt your snacks. So try to choose some lower sodium or no salt added nuts, seeds, or other snack items. We know that there are a lot of snack foods that have salt and they are delicious, but it adds up very quickly. And consider your condiments. So making sure that when you're looking at those condiments, you're choosing reduced sodium or light condiments. Opt for oil and vinegar rather than bottled dressings when possible, and try to use a small amount of seasoning from flavor packets that you might find in different foods, or ditch the flavor packet altogether and season it yourself. That's going to be a really good way to limit that sodium.
Okay, so the first one is potassium. And so potassium is a mineral that helps to dilate or widen our blood vessels. And it can also help us to get rid of more sodium in our urine. So if we're not getting enough, we can have increased blood pressure. And it's actually been found that potassium intakes are inversely related to blood pressure. So what that means is as our potassium intakes go up, blood pressure tends to go down and vice versa. And it also can affect how salt sensitive we are. So that means if we aren't getting enough potassium, then we can be a little bit more, our blood pressure is more sensitive to the sodium that we do have in our diet. And so the DASH diet recommends eating about 4,700 milligrams of potassium a day. So this is just some examples of some of the higher sources. In general, most fruits, vegetables, legumes, nuts, dairy, seeds, and certain proteins are going to be either some pretty good sources of potassium. So this is just some of the higher ones that we see. And potassium is actually required to be on food labels. And so that makes it really helpful for finding higher potassium foods. And you can actually track your intakes if you want to. So next is magnesium, sorry. And so magnesium can have a calming effect on our bodies and our muscles. And this is also true for our blood vessels. It helps them to relax, which can lower blood pressure. The DASH diet recommends getting around 500 milligrams a day. And this is especially important if you're on certain medications that can cause deficiencies in magnesium. That might be certain diuretics and proton pump inhibitors that are used for heartburn. Certain diuretics can also cause us to have lower potassium levels as well. These are some examples of the higher magnesium foods, looking at leafy greens, dark chocolate, nuts and seeds, beans, avocados, yogurt, things like that. You can also find magnesium in proteins like fish, chicken, or beef. And the last one is calcium. So calcium also helps with our sodium balance in our bodies. It helps our blood vessels to expand and contract, and it can help decrease blood volume. And all of these will contribute to lowering blood pressure. And so just like with potassium and magnesium, if we're not getting enough calcium, then that can cause our blood vessels to be tighter or narrower and not as relaxed, which is what will increase our blood pressure. Not getting enough can also have a negative impact on our bones because it might cause calcium to be pulled out of our bones in order to meet our needs. So the DASH diet wants us to aim for about 1,250 milligrams per day. And ideally, we'll get most of this from food sources so that we can get the best absorption and use in the body. Here are some of the primary sources. There's dairy and non-dairy sources. We typically think of dairy products as being known for being good sources of calcium, but for those that maybe are lactose intolerant or sensitive to dairy, there are a lot of good non-dairy high sources as well. Things like leafy greens, fatty fish like sardines and salmon, beans, nuts, and seeds. Those are all great examples. So when it comes to these minerals in the DASH diet studies, and I think we've mentioned this before, but it was found that the diet needed to be rich in all of those minerals, potassium, magnesium, and calcium, in addition to lower sodium intakes to have the biggest impact on lowering blood pressure. So now we'll look at fiber intake. So it recommends at least 30 grams of fiber daily. And higher fiber diets, especially those that are higher in soluble fiber, are linked with more than just lowering blood pressure. They've also been found to help with lowering cholesterol, with weight loss, with improving blood sugar, and in improving our gut health and cancer risk. In general, if you're eating a diet that's full of whole grains, fruits, vegetables, nuts, seeds, legumes like beans and lentils, it's naturally going to be higher in fiber, and it's going to make it a lot easier to meet that goal of 30 grams or more per day. These are some examples of some higher fiber foods. And fiber is also required to be on food labels. So if you're looking at a label, if it has 4 grams or higher, that's considered a higher source of fiber. And that's something that you can look for when you're comparing products. Now looking at fats, so in the DASH diet studies, they had about 27% of the calories come from fat. So they aren't encouraging a fat-free diet because we do need fat in our bodies for many things. But the emphasis is on limiting foods that are higher in saturated fat, like fatty meats and full fat dairy, and trying to consume more plant-based sources of fats and lower fat dairy. You can see there's a couple different types of fats, unsaturated and saturated. Saturated come more from animal sources, and then certain oils like coconut and palm oil. Unsaturated fats are the mono and polyunsaturated and omega-3s. Those typically come from plant sources and marine life like fish. Here's just kind of some more examples of unsaturated fats. And here's a little bit more on label reading, specifically when it comes to fats. So if you are looking at the grams of fat, if you're choosing foods more often that have less than 5 grams of total fat or less than 2 grams of saturated fat per serving, then it can help to keep your fat intake in balance. And something to be wary of is trans fats. These have been found to have a really negative impact on heart health. And labels, if the food has less than half of a gram of trans fat per serving, they can technically say that it's trans fat free. So if you want to look for hidden trans fats, always look at the ingredients list. And if it says partially hydrogenated in there, then it does in fact contain trans fats. So looking at proteins, the emphasis is on lean proteins. A good serving is about 3 to 4 ounces, which is about the size of a deck of cards. As far as the fat and proteins, looking for poultry, looking for white meat or the breast meat without skin, for beef, pork, or lamb, looking for less visible marbling, or at least cuts of meat that you can easily cut the fat off of. Eating a variety of fish is great, and it's a really good source of omega-3 fatty acids. And then instead of always choosing animal proteins, you can consider alternating in vegetable protein foods sometimes, like beans, lentils, tofu, nuts, seeds, things like that. And this also helps to give additional sources of fiber and those other nutrients that we're looking for in the DASH diet. The last thing we'll talk about is added sugars. So the DASH diet recommends less than 3 servings per week if you're eating about 1,600 calories, and then less than 5 servings per week if you're eating about 2,000. And it gives us some examples of what they consider a serving, maybe a tablespoon of sugar, or a half a cup of sorbet, or 1 cup of a sugar sweetened beverage. And so it's limiting the servings by week instead of by day. It's actually a little stricter than the American Heart Association, oops, I spelled that wrong, association recommendations that are listed there. And so added sugars can be found in more foods than we realize. So we can learn a lot by looking at the labels. And added sugars is now something that is also required to be on label. So it makes it a little bit easier to identify when food has added sugars. It'll list the grams on there. But you can also look at the ingredients list and look for some of these terms in addition to just regular sugar. Things that end in ose, any type of corn syrup, invert sugar, malt sugar, molasses, honey, all of these things are just other words for sugar. Here's just some practical tips while you're implementing the DASH diet. Frozen fruits and vegetables can be an easy and more economical way to store and have these things more readily available at home. If you're filling half your plate with non-starchy vegetables, then there's going to be great sources of fiber and then some of those nutrients that we talked about. Some tips on choosing healthy snacks, adding beans, legumes, or nuts to salads, and then always trying to balance your meals and snacks with protein and fiber, because that can really help to fill you up. This is just an example of what a day on the DASH diet might look like. I pulled this from the Mayo Clinic website, and it was interesting on there. They also had the nutrient breakdown. I did include it, but it showed that this particular day here did meet the guidelines for the DASH diet for calcium, magnesium, potassium, sodium, and fiber. And they also had some other menus on their website as well. These are just a few resources that might be helpful if you're thinking about implementing the DASH diet. The National Institute of Health, it has some great educational resources, and it also has a lot of the information on the research studies that were done using the DASH diet and the results of those studies. There's the Oregon Dairy Council, and then there's dashdiet.org. It has some great recommended books and recipes on there as well. And lastly, these were just a list of the references that were used in creating the presentation today. Again, if you're watching the recording, you can always pause and take a closer look at these.
Okay, one of our first questions is, can blood pressure change with age? Can it jump from under 120 to over 130 over 1 year?
So in answer to that question, yes. Just like anything with age, things change as we get older, and parts of our body just do not work as well as they used to. And hardening of arteries does happen with age. Sometimes we don't know why people have higher blood pressure, but in general, yes, it definitely could jump from under 120 to over 130 in just 1 year.
Perfect. Our next question is, how does the DASH diet differ from the Mediterranean diet?
And that's a great question. They are very similar in many ways, but the DASH diet, generally speaking, focuses on lower fat options. The Mediterranean diet has a very heavy emphasis on olives and olive oil, as well as fish. And it's not saying that the DASH diet does not have these things as part of it, but it's not as much of a focus. The DASH diet also focuses a bit more on dairy, especially the calcium content. And the Mediterranean diet has dairy a bit more moderately than the DASH diet does. But there are definitely crossovers and similarities.
Okay, can one sodium level be too low? If so, what would be the effects of too low sodium?
Jen, do you feel comfortable taking this one?
Is that levels in the body or intakes?
I would guess in the body.
In the body. It can be too low, yes. And if it is, I've seen people in the hospital with lower sodium levels, and they might have symptoms like headache, confusion, nausea, sometimes vomiting. You can get muscle cramps and things like that. If it gets really severe, it could be dangerous. Yes.
Okay, are minerals from supplements as bioavailable as those from the diet?
I think it really depends. A lot of vitamins and minerals like to coexist and work together for best absorption. So in food, those other vitamins and nutrients are usually present to help with them being most bioavailable. There's a lot of things that can affect that though, whether you have problems with absorption, maybe you have genetics that are making it a little bit harder for you to absorb things or to convert certain nutrients into the form they need to be in your body for you to use them properly. And in those cases, maybe supplements can be helpful if you're one of those people that struggles with that. But in general, yes, it is always best to get things from food as much as possible.
Okay, is fully hydrogenated trans fat, is fully hydrogenated fat trans fat free?
That's kind of a tongue twister. I think I understand the question though. So fully hydrogenated fat does not mean trans fat. So, it's actually, this is a really good topic because we used to see trans fats quite often in foods, and you would see those listed as partially hydrogenated fats because trans fats actually started off as an unsaturated fat, and they added more hydrogens to the molecule to kind of straighten it out to make it more solid at room temperature. And these were actually found to be really bad for us. Now, there were a lot of food manufacturers that were starting to move away from trans fats, but as of January 1st of last year, no food manufacturers can use trans fats anymore. So in products that are new, you should not be seeing any trans fats, but in things that you've maybe had for a while, because trans fats do increase shelf life of foods, you might still see trans fats on there. So again, no, fully hydrogenated fats are not trans fats. Those are saturated fats. So again, something that we still want to limit.
Okay, don't fresh fruits contain a lot of natural sugars? How many per week are allowed?
So yes, fresh fruits definitely contain a lot of natural sugar. They also contain a lot of fiber in various forms. How many per week are allowed? Oh gosh, math. Oh my goodness. That really depends on the person and different conditions that they might have. So people we work with diabetes, it might be a bit different and it might affect their blood sugar differently. But generally speaking, you know, general recommendations for fruit intake could be like 3 to 4 servings per day. So that's not necessarily 3 to 4 pieces of fruit because they all come in different sizes, but it's servings. So per week, I guess we'd have to multiply that out by 7 depending on goals, but we usually say per day, like 3, 4 maybe.
Well, thank you for that great presentation, and thank you everybody for joining us today. A link to a survey will be provided in the Q&A box, and we would really appreciate it if you can give us your feedback regarding today's presentation. Also, please watch for the follow-up email that will include a link to the recording, and be sure to visit samhealth.org/behealthy to learn about more upcoming seminars. Thank you, and have a great